Okay, let's dive straight in. When you look at depression around the world, the scale is just staggering.
It really is. We're talking a leading cause of, well, disease burden, disability globally. It affects so many people.
Hundreds of millions.
Yeah.
And the cost, not just money, but, the human cost, it's immense.
Absolutely. And that's why finding effective strategies is so critical, not just for treating it, but crucially for preventing it.
We need ways people can actually reduce their risk before it starts.
Exactly. Identifying those proactive steps is a massive public health priority.
And one thing that keeps popping up again and again is physical activity, moving your body.
Right. We've sort of known intuitively and from research that it's generally good for mood.
But the big question, the one that always hangs there, is how much? Is there a magic number? Do you need to be like running marathons?
Or it's just getting off the sofa enough.
Exactly. What's the actual dose, if you like?
That dose-response relationship, that's really the key question. Past studies often just lump people into active or inactive. A bit black and white.
Yeah, precisely. We didn't have a clear picture of the shape of that relationship. What happens is you go from doing nothing to a little bit to quite a lot.
Which is exactly what we're getting into in this deep dive. We're looking at a really significant systematic review and meta-analysis. It was published in JAMA Psychiatry.
Very major journal, yes.
And the specific mission was to map out that very dose-response relationship, physical activity, and the risk of actually developing depression over time.
And they tackled it with some serious analytical firepower. They brought together data from 15 large prospective studies.
Prospective meaning they've followed people over time.
That's right. They looked at people's activity levels at the start and then tracked who developed depression later on. It's a strong design for looking at risk factors.
And the scale.
Huge. Over 191,000 participants in total.
Wow.
Which translates to more than 2 million person-years of follow-up data. So it's a really substantial evidence base to try and answer this how much question. Okay, so they crunched all those numbers, looked across all those studies. What was the main takeaway? What's the sort of headline finding about activity and depression risk?
Well, the central finding was pretty clear. They found an inverse curvilinear dose-response association.
Okay, inverse curvilinear. That sounds technical. Let's break that down a bit. What does that actually mean in plain English?
Okay, think of it like this. Inverse means as one thing goes up, the other goes down. So, more physical activity, lower risk of depression. Simple enough.
Right, makes sense.
But curvilinear means it's not a straight line down, it's a curve. The whisk drops really sharply at the beginning when you go from doing very little activity to doing some.
Ah, okay, so the biggest bang for your buck is at the start.
Exactly. The curve is steepest then. As you add more and more activity beyond a certain point, the risk continues to drop, but much more slowly. The curve starts to flatten out.
So it's not like every single extra minute you exercise gives you the same amount of depression protection. Those first steps are disproportionately powerful.
That's precisely the crucial insight here. Moving from being basically inactive to doing even a moderate amount of activity seems to confer the largest relative risk reduction.
That feels like a really important message, maybe even a bit surprising for people who think you need to, commit to really intense workouts to see mental health benefits.
It is encouraging, isn't it?
Can we put some numbers on this? They must have quantified these levels, right?
They did. They measured the risk reductions compared to adults who reported doing essentially no physical activity at all, and they used this standardized metric.
Right. I saw that. METHWK.
Yes, marginal metabolic equivalent task hours per week.
Okay, METs. Remind us quickly what a MIT represents.
Sure. 1 MIT is basically the energy you use just sitting quietly. So an activity's ME value tells you how much more energy it uses compared to sitting. Brisk walking might be, say, 3 or 4 METs. Running could be 8, 10, maybe more. So the MET hour metric combines the intensity, the MT level, and the duration, the hours, into a single weekly score for total activity volume. It lets you compare, say, an hour of running versus 2 hours of walking.
Got it. It's like a total energy expenditure score for activity.
Pretty much, yeah. It standardizes everything. And what they found was that getting just half the currently recommended volume of activity.
Half?
Yes, half. Which worked out to about 4.4 millimet hours per week in their analysis. That was linked to an 18% lower risk of depression compared to doing nothing.
18% lower risk just for hitting half the target?
Yeah.
That's actually quite substantial for what sounds like not a huge amount of effort.
It really is. And it gets better. For those who met the full recommended volume, that's 8.8 millimeters per week, the association was a 25% lower risk of depression.
25% lower risk. Okay, so what does that 8.8 millimeters hours look like in, real life? What kind of activity are we talking about?
So the authors helpfully translated that. They said 8.8 millimeters hours per week is roughly equivalent to about 2.5 hours per week of moderate intensity activity.
2.5 hours a week, like brisk walking, gardening, maybe some cycling.
Exactly. Things that get your heart rate up a bit, but you can still hold a conversation. If you break it down, that's maybe 30 minutes, 5 days a week.
Okay, that sounds achievable. Manageable for a lot of people.
It does, doesn't it? And for that, potentially a 25% lower risk of developing depression compared to being sedentary. That's a really compelling return on investment for your time and effort.
It really is. And it totally backs up that curvilinear idea. Getting from zero activity up to that 2.5-hour mark gives you a huge chunk of the benefit.
Yes.
So what about going beyond that? Like people training for races, doing hours and hours a week. Does the risk just keep plummeting?
Well, that's the other side of the curvilinear coin. The study found diminishing additional benefits and also more statistical uncertainty at activity levels above that recommended 8.8 millimeters hour mark.
So the curve really flattens out.
It seems to, yes. It suggests that while doing more activity is certainly not bad for mental health, and obviously has other physical benefits, the steepest gains in terms of depression prevention seem to happen in that initial phase, going from inactive up to meeting those minimum guidelines.
So you don't need to be an ultramarathoner to get the lion's share of the mental health protection, according to this data. Hitting that moderate 2.5 hours a week mark is key.
That seems to be the strong message from this large analysis. It's quite empowering, I think. It makes it feel less daunting.
Definitely. Thinking bigger picture now, if more people actually did hit that 2.5 hours a week target, what kind of impact could that have on a population level?
Yeah, they actually modeled that. Based on the typical activity levels they saw in the study participants, they estimated something pretty remarkable.
Okay.
They calculated that if all the less active adults in those cohorts had increased their activity to meet that minimum recommendation, the 8.8 millimeters hours per week, then potentially 11.5% of the depression cases observed in those groups could have been prevented.
Wow. 11.5%, just by getting people up to that basic recommended level.
Exactly. It sounds like a percentage, but think about the sheer number of people affected by depression globally. That 11.5% represents millions and millions of cases.
That really puts it into perspective. It frames physical activity not just as a nice-to-have, but potentially as a major public health tool for prevention.
A very accessible one, too, for many people. It underscores that potential for widespread impact if we could just support people in becoming even moderately more active.
Did the analysis dig into how depression was measured? Like, did it matter if someone had a formal diagnosis from a doctor versus just scoring high on a symptom checklist?
Yes, they were careful about that. The studies they included used different methods. Some relied on clinical diagnoses from physicians, registries, or structured interviews. Others used validated screening tools to measure elevated depressive symptoms.
And did that change the basic finding? Was the curve different?
Interestingly, no. That inverse curvilinear shape held up for both types of outcomes. Whether it was diagnosed major depression or elevated symptoms, the pattern was similar. Risk dropped fastest at lower activity levels, then flattened out.
But I think you mentioned earlier something about the potential impact being different between those two.
Yes, that's right. The potential impact fraction, that estimate of preventable cases, the 11.5% figure we just discussed, for the overall, it was actually higher when they looked specifically at studies focusing on elevated depressive symptoms compared to those focused on major depression diagnoses.
Why would that be, if the risk curve looks the same?
The researchers suggested a pretty logical reason. It seems the participants in the studies that measured symptoms tended to start out, on average, being less active than the participants in studies looking at formal diagnoses.
Okay.
So because that group started from a lower baseline activity level, getting them up to the recommended 8.8 millimeters hours represented a bigger relative jump in activity for more people in that group.
I see. So more room for improvement in the symptom-focused groups meant a larger estimated prevention effect when modeling everyone hitting the target.
Exactly. It depends on the population's starting point. If a population is generally more sedentary, the potential public health gain from increasing activity looks larger.
That makes perfect sense. Now, obviously, this is observational data. It shows strong associations, but it's tricky to definitively prove cause and effect.
Right. Always a consideration, yes.
But did the paper touch on how activity might actually be working? What are the potential mechanisms behind this protective effect?
They did discuss some of the leading theories covering both biological and psychosocial pathways. These are potential explanations, mind you.
Sure. What are some of the biological ones?
Well, there are the acute short-term effects right after exercise, things like changes in neuroendocrine responses, think stress hormones and inflammatory pathways, maybe even the release of endorphins, the sort of runner's high effect, though that's complex.
And longer term.
Longer-term consistent activity might lead to more lasting adaptations. They mentioned potential changes in neural architecture, the structure and function of the brain itself. Things like promoting the growth of new neurons or improving connectivity.
Actual physical changes in the brain from exercise. That's pretty amazing.
The brain is remarkably adaptable neuroplasticity, and exercise seems to be a powerful stimulus for positive changes. Then there's the psychosocial side, too.
Like how it makes you feel about yourself.
Exactly. Things like improved self-perception, better body image, maybe increased self-efficacy from setting and achieving activity goals. Plus, many activities offer increased social interaction, which we know is protective for mental health.
Or just developing better coping strategies through the discipline of regular activity.
Potentially, yes. So it's likely not just one thing, but a whole cocktail of biological and psychological effects working together.
A complex picture. Did they mention anything else that might influence this relationship? Maybe things in our environment?
Yes, they briefly touched on that. Some research suggests environmental factors could act as moderators. For instance, having access to green spaces, like parks, seems to be linked independently to lower depression risk and might enhance the benefits you get from being active outdoors.
Makes sense. Nature is good for the soul, as they say.
Right. But conversely, negative environmental factors may be high levels of noise pollution, or living in a neighborhood that feels unsafe, or lacks facilities that could potentially diminish the mental health benefits of activity, or just make it harder to be active in the first place.
So your surroundings could play a role in how much mood boost you get from a walk.
It's plausible, and these kinds of factors could also contribute to what they called heterogeneity between the studies.
Ah, yes, heterogeneity.
Yeah,
You mentioned that the results varied quite a bit between the 15 studies they included.
they did. They reported a high I-squared statistic, 74% overall. That basically measures how much of the variation in results across the different studies is likely due to real differences between them rather than just random chance.
And 74% is considered high.
Yes, that's substantial heterogeneity. It signals that while the overall average trend is clear, the specific results did bounce around quite a bit from study to study.
Did they figure out why? Did they test if certain things explain that variation?
They tried. They ran analyses called meta-regressions, looking at whether differences in things like the study population's sex mix, or how depression was measured, or how long follow-up was, or whether they excluded people already depressed. Whether any of that explained the variability.
And
Interestingly, none of those factors seemed to statistically account for the high heterogeneity they saw.
so even after checking the usual suspects, there was still a lot of unexplained variation. What does that mean for interpreting the main finding?
It means we should be a little cautious about applying the exact average number, like that 25% risk reduction, to every single person or population. The overall inverse curvilinear trend seems robust, but the precise magnitude of the effect might well vary depending on context, potentially due to factors they couldn't measure across all studies.
Okay, so the general shape holds, but the specifics might differ. That's useful context. What about other limitations? Every study has them. What else did they flag?
Well, a big one in this kind of research is always the potential for reverse causality.
Right, the classic chicken and egg situation. Does being inactive lead to depression, or does developing depression, maybe even before it's diagnosed, make you less active?
Exactly. Someone might be feeling low, lacking motivation, early signs of depression perhaps, and stop exercising because of that. Then later they get diagnosed and it looks like inactivity came first.
How did they try to deal with that?
They try to minimize it. They only included studies with at least 3 years of follow-up, giving more time for activity levels to potentially influence depression risk rather than the other way around. And they excluded people with prevalent depression at baseline wherever possible.
But it's hard to completely rule out, especially for maybe mild or undiagnosed cases.
It is. They acknowledge it remains a possible limitation. Another point was the reliance, in most of the original studies, on self-reported physical activity.
People aren't always great at remembering exactly how much they exercised.
Precisely. There can be recall bias or social desirability bias. People might overestimate their activity levels. Wearable trackers like accelerometers would be better, but weren't used consistently across these older studies.
Makes sense.
Mm.
Anything else?
They also noted there wasn't a huge amount of data at the very high end of the activity spectrum, so the estimates for, say, elite athlete levels of training are less precise.
And the population studied, were they diverse?
That was another limitation. The vast majority of the studies came from high-income, mostly Western countries. So there's an underrepresentation of data from lower and middle-income countries.
Meaning we have to be a bit careful generalizing these findings globally.
Yes, ideally we'd need more research in diverse settings. They also mentioned they didn't have enough detailed data across the studies to do robust subgroup analyses, like is the effect different for men versus women or for different age groups?
Okay, so really strong overall findings from a massive data set, clearly showing this dose-response curve, but with the usual caveats around observational data, measurement methods, and the need for more diverse research.
That sums it up well. It's a landmark study in clarifying the dose response, but science is always ongoing.
Right. So let's try and boil this all down as we wrap up this deep dive. What's the single most important takeaway message someone listening should get from this meta-analysis?
I think the core message is both powerful and, frankly, quite hopeful. Physical activity really does seem to be an effective tool for helping to prevent depression. That comes through loud and clear.
And the key part about how much.
And critically, this research provides really strong evidence that you absolutely don't need to become some kind of elite athlete to get significant mental health benefits.
It's those first steps that count the most.
Yes, the benefits are substantial, even at relatively modest levels of activity, especially when moving from being sedentary up towards meeting those minimum guidelines, that roughly 2.5 hours of moderate activity a week we talked about.
That's where the steepest drop in risk occurs.
Exactly. While doing more probably doesn't hurt and has other benefits, the main punch for depression prevention seems to come from achieving that consistent, moderate level of movement.
It really reframes the goal, doesn't it? Away from maybe intimidating high-intensity targets and towards just consistent, accessible movement.
It does. And thinking back to that potential impact, preventing maybe 11% or more of cases if less active people met those guidelines, it just highlights what a profound difference this could make individually and for society.
So for you listening right now, maybe the thought to take away is this. Your activity level isn't just about your physical health. It seems directly and significantly linked to your risk of depression, particularly if you're not very active currently. Even small increases could make a real difference.
It's definitely food for thought.
And perhaps take it one step further. Think about your own world, your environment. Does it support you being active in a way that feels good and benefits your mental health? Or are there barriers, maybe time, access, safety, motivation that get in the way? What might need to change for you, or maybe even more broadly, to unlock those benefits? Just something to ponder from the simple act of moving your body a few hours a week.